What's up, you guys? This is Bo Miguel giving you your daily dose of radiation. Today's video, we're covering why working in the healthcare field slowly corrupts your perspectives on doctors. So this is a very controversial topic, I suppose, because for the common people who are not in the field, which I am an Xray tech, been doing it for 4 years, work night shift and day shift. For the common folks, the doctors, the lawyers, all that are the all well-knowing individuals. Which me going into the field for the first year, I was the same as anyone else. I'm like, the doctor is here to help me, is here who went to school so many years to get the knowledge, and they'll pass that exams, whatever, to be in their position. Which all doctors who are within their field, they all deserve their respect, because like even looking into what they do and even what I do, I'm like, I went through maybe a tiny percent of what these doctors gone through to get their credentials. Like it takes us like a certain level of like smart, like well-rounded person to you don't just get up there just by cheating and bullshitting. Like there's certain level of respect and level to get where they are. Okay, I will not dog on that. Certain doctors that you'll kind of work with that will kind of almost corrupt your perspective on why do you do what you do type of situation. So I would say like certain doctors are more notorious for ordering more stuff, almost unnecessarily amount, because they're uncertain for themselves, or they would rather to overcover than to undercover. And they'll go, not that they go above and beyond, but they're kind of don't know, how do I put it? Imagine they're trying to find the needle in the haystack, right? So it's in there. Maybe you don't know what's wrong with the patient, so you order all kinds of stuff, hoping to God from all that stuff that was ordered that one of those can tell you this is what's wrong with it. So what ends up happening, and I'm just strictly talking from my field, can't talk about the nurses. Well, I can kind of talk about the nurses, cause just based off of what I see, but I'll cover it later. Just in my field, X-ray and radiology, they'll order chest X-rays. There's patients that they've ordered ungodly amount of stuff, which I personally think was unnecessary. Sometimes even the patients are like, why? Why are they doing this? Why? Like, I don't, like, even they'll refuse it, and then we'll tell the doctor, only certain doctors. Other doctors will be good. They'll order this, and this, straight to business. They're always like, hey, if you ordered a wrist, right? And you see that maybe it goes, there's some significant issues with a little bit higher, maybe shoot or open the collimation up. Obviously, if I see something like, let's say it's like a wrist and it's broken, right? And there's a crack that goes up here. I'm not just gonna be like, nope. I'm gonna open the collimation up a little bit, And if the crack's still, even if I go like a wrist, usually you'll shoot about right there. If I open a little bit more, and there's still a crack, I'm gonna be like, hey doc, you might want to order a hand, because and then I'll show them the picture, and they're like, oh yeah, there's significant damage. Let's get stuff like that. There's certain stuff like that it makes sense why you would order a little bit more. Other doctors, I've seen it before, where their hand hurts and they've gotten their hand all the way to their shoulder shot. Certain patients are like, why? And other ones are like, oh, okay, the doctor gotta know what they doing, so they just be doing. And even so, when we get those doctors who order the ungodly, ridiculous skeletal survey on patients, as a tech, you're doing it, and majority of the times, only maybe one of the pictures comes up with there's something wrong with everything else. Remarkable, nothing wrong with them. Certain doctors are more notorious for doing that. And every hospital has them. Other doctors order, I guess, what they need and get the job done. Other ones order way more because they're not sure what's wrong with the patient. And other ones, like, that's what kind of corrupts your perspective on the doctors. Certain doctors. And, like, the one in our hospital who orders the ungodly amount of necessary exams, the most nicest doctor I've ever met. If you just sit down and talk to them, the most nicest. Can't even be mad at them. They're just so nice. But they will make you work hard. I will let you know that. They will make you work hard. Other doctors I've seen to the point where if you're like, hey, let's say they order L-spine. Hey, you want L-spine? So to get L-spine, you shoot an AP, and then the patient got to go on their side. And we shoot a lateral. The patient is da-da-da-da-da. Can't do it. Doesn't want to roll over. Is in pain, whatever. Can you maybe CAT scan? Because they're already going to be in CAT scan to get da-da-da. And some doctors are like, oh, yeah, don't worry about it. We'll just CAT scan. We'll do the L-spine and the thing. We'll get the same thing, type of the other ones will look at you and they're like, why? Why can't you do it? And then we tell them, so then do it. And then you're just like, well, I'm going to need more help. Well, then go get more help. And da-da-da-da-da. And then sometimes they'll come in and they'll see us because they have maybe questions on why is the picture taking too long or some other stuff that's happening. And they'll come in and we're trying to get this L-spine or whatever it is on this old patient or someone who's hurt or whatever. And they see us struggling and they'll just sit there in the back just looking. Sometimes it's gotten to the point where it's been the patient will get hurt if no one else helps. And I've literally seen it where doctors just sit in the back just nope. I've seen it before. And we're like, yo, bro. Other nurses, CNA, other people will come in and run in and help, and the doctor just be in the back. Other doctors, if they see some shit that's going to happen like that, they're like, yo, I'm going to intervene. I'm going to help out, whatever. Because I don't want to deal with more stuff. And other ones were like, nope, but we just CAT scan them now. Head CT, whatever. I've literally seen them, and I'm like, bro, why didn't you help us? And they're this is not my job, it's not what I do. I get almost a sense of arrogance of, I'm here to help people, and I just be giving orders and stuff, but I don't do the actual physical care stuff. I don't know. There's certain doctors, the other ones, praise them, love them. Other ones are, it's a mix of both worlds with any other profession. There's good and bad. There's certain ones that understand I'm just speaking as far as Xray. I have doctors that their wife or their husbands or whatever is in our field, is a radiologist, is a whatever. So they understand. So there's more common knowledge, or they know more, they understand, or some of them, they're like, yeah, I was an X-ray tech, now I'm a doctor, so they understand. It's different, it's all different stuff, So with that being said, there's good and bad, well, not really bad doctors, but there's certain doctors that you have to be not just aware, but just work around. And that's kind of almost opened my mind to where me being on the other side, when I'm sick, when I'm hurt, and they order stuff. And you can quickly see, because you're in it all the time, when there's a doctor who come in and they're like, we're going to do this, get you feeling better and stuff of business. And then you're just like, yeah, straight to business, this is what we need. It all checks out. And then sometimes there's a doctor who come in and be like, hey, we're going to do da-da-da-da-da. Just ungodly amount. And you're like, bro, it's just my pinky toe that hurt, bro. What? There's no need for all that. It's just pinky toe. So even when that's happened, even with my kids, and then I see certain doctors will do that. And I'm like, it's not necessary. It's just this. And they'll do that, and then something comes up, and I'll be like, see how the problem's right there. Didn't need to do all that. So it's something to be aware of for yourself. But for the common folks, they don't know. They're just, doctor's a doctor. So keep that knowledge as you wish. It's just me speaking my perspective in my field. I know that in nursing and other departments, they probably do the same, because when certain doctors work that order a lot and do a lot, every department's running like little ants, or you can see by the end of the shift, everyone looks like they're tired. So yeah, it's been Miguel. See you on the next one.